The funding will support surveillance in high-risk districts at the border with DRC, risk reduction communication amongst communities, infection prevention and control measures, as well as provide for improved case management.
And the work done at this research institute, the strong partnerships that we have with UK institutions like the London School of Tropical Disease and the various Medical Research Council programs that I've seen today here, are helping to not only develop an experimental vaccine in terms of Ebola, but also ways to identify very quickly when cases occur.
According to Baldwin, the UK government and World Health Organization judge Uganda's current preparedness efforts towards disease catastrophe as strong.
As you know, there is an outbreak of Ebola at the moment, some 20 miles west of the Ugandan DRC border, and so we need to make sure that we prevent Ebola getting into Uganda. But if there were an unfortunate example of a case arriving in Uganda, it's important for Uganda to be ready.
The Uganda Virus Research Institute has played a very important and critical role in early detection and prevention of illnesses that are harmful to human life, especially those that cause hemorrhagic fevers. And now this investment by partners from the UK is very important because it will help them acquire the much needed resources.
To conduct research, to pay our staff, equipments that we have seen, the buildings that we have seen, the training of our staff.
Professor Pontiano Kalebu, the executive director of the Uganda Virus Research Institute, said the institute is now worried about the recombinant type of viruses from infectious diseases.
The virus that we see are so unique. One virus does not look like the other. So the viruses are recombining, and that could be a problem for discovery of a vaccine.
The risk of Ebola spreading beyond the border from DRC is high, but Professor Kalebu says their teams on ground are on high alert too.
You have heard that the ministry working with WHO, Firday and others are now preparing to vaccinate so that in case we have any case of Ebola, we do what we call ring vaccination. We vaccinate all the contacts.
Uganda has not had any reports of Ebola since the last outbreak in 2008. However, there have been outbreaks of other hemorrhagic fevers, including Marburg and recently the Rift Valley fever. Walter Mwesije, NTV Weekend Edition.